Welcome to the second annual A Better Start National Evaluation Podcast.
Welcome to the second in our podcast series where we discuss our evaluation of A Better Start. A Better Start is a £215 million programme funded by the National Lottery Community Fund. My name is Mary McCaskill and I'm really looking forward to today's discussion. A Better Start, commonly referred to as ABS, is a 10-year programme running from 2015 to 2025. It's made up of 5 partnerships based in Blackpool, Bradford, Lambeth, Nottingham, and Southend-on-Sea, who support families to give their babies and young children the best possible start in life. Working with local parents, the 5 ABS partnerships are developing and testing ways to improve their children's diet and nutrition, social and emotional development, and speech, language, and communication. The work of this program is grounded in scientific evidence and research. ABS is place-based and enables systems change. That is, to change for the better the way that local health, public services, and the voluntary and community sector work together with parents and communities to improve outcomes for children. It aims to improve the way that organizations work together and with families to shift attitudes and spending towards preventing problems that can start in early life. We, the ABS National Evaluation Team, are a consortium of 5 organisations who are evaluating the impact of A Better Start. We are the National Centre for Social Research, RSM, the University of Sussex, Research and Practice, and the National Children's Bureau. Our evaluation work is divided into 4 different parts. We sometimes refer to these as objectives. Each part of the evaluation is running at the same time. In this podcast, we'll hear from each of the objective leads and reflect on the ways in which challenges in the evaluation have been overcome and what that means for the evaluation and our learning about the impact of ABS as a whole. We'll also share some of what we're learning from this evaluation and let you know what you can look forward to in the upcoming annual report. The first part of our evaluation work is being led by the National Centre for Social Research and identifies the contribution made by ABS to the life chances of children. This work is being done through collection of data about child outcomes from NHS England and the Department for Education, as well as reviewing data which is being collected locally in each of the 5 ABS partnerships. The second part of the evaluation, also led by the National Centre for Social Research, identifies how ABS services contribute to improving children's diet and nutrition, social and emotional skills, and language and communication skills. We are capturing this evidence through interviews with staff who work within the ABS partnerships and from professionals who work with the National Lottery Community Fund. We are also carrying out interviews with early years professionals based in other parts of England that are not part of the ABS programme to understand any differences and similarities in non-ABS areas. The third element of our work is being led by the University of Sussex. They are working with families across all 5 ABS partnerships to understand the experiences of families that have been part of ABS. And the fourth part, led by RSM, evidences the contribution made by ABS to reducing costs to the public purse relating to primary school-aged children. We are using an approach known as contribution analysis to bring together the 4 different parts of the evaluation to form a mosaic of evidence. This will help us to tell the contribution story of the effect which ABS has had on the lives of families with babies and young children. First, I'm here with Dr. Enes Dusak, who leads the quantitative outcome evaluation of ABS. Enes, to start the conversation, could you give us a summary of the work that's taken place over the past year?
For the past year, our work has involved setting up a recruitment process for ABS service users to give consent if they're happy for their data to be included in our quantitative analysis. We have also made requests for administrative data from the NHS England and the Department for Education, again, for us to use in our analysis. The quantitative analysis is going to take place at the end of this year. This is so that we can wait for long enough to be able to see whether over time taking part in any ABS services leads to any meaningful change in children's outcomes. We have taken some big steps forward this year so that we will be ready to deliver the analysis when the time comes.
It's such an ambitious element of the national evaluation. And I just want to give a reminder to listeners that you can find more technical information about the methodology that we're using in the protocol that's available on NatCen's website. You can also listen to last year's podcast, which was the first of this series, on our YouTube channel. Now back to the conversation. Anas, can you tell us about any particular challenges that the team has been working through?
Of course. One of the great things about our methodology is that it entirely makes use of the data that already exists. This means that we don't need to ask families to spend time completing surveys to provide us with new data. But this aspect also brings us challenges, since we are relying on existing data sources that can vary substantially, both across ABS partnerships and across different health and education outcome areas that we are looking at. Our work has required us to develop a really detailed understanding of a relatively complex data landscape. This has involved careful work to figure out the practicalities of exactly how we will access and bring together all this information in a clear and meaningful way. We have had to overcome several difficulties and challenges along the way.
Yes, as you say, it's brilliant that we're able to explore these outcomes with existing data and not having to collect more primary data from participants. But that doesn't mean that it doesn't come with its own set of challenges. Can you share any examples of some of the hurdles that your team has encountered?
Of course, that is so true. In most sites, our analysis approach starts by asking for consent from ABS service users for personal data about them to be shared with the NatCen evaluation team. We will then securely send this data to NHS England so that they can locate the health outcomes of those consenting participants before removing all personal information, including names, NHS numbers, etc., and sending the data back to us for analysis. But there is one site where in our early discussions, we found that this would not be possible. The reason was that the particular IT infrastructure used in that site did not allow for any identifying information about the service users to be shared outside of the site team at all, even if the participants gave their consent for this.
Interesting. So how have you been working to overcome this issue?
So we were faced with a decision of how to overcome that challenge. One option could have been to work with the site to entirely rebuild their IT system so that we could follow our original plan. But this would have created an enormous amount of work for the site and require undoing a system that they had carefully designed and worked with for years. Instead, we work together with the site to find an alternative analysis approach that will work for their data systems. Instead of beneficiary details being shared outside the site to be linked with health records, under the new approach, this site will instead bring together health outcome data inside their own IT architecture. They can then pseudonymize the data, which means removing personal information like beneficiary names, NHS numbers, etc., and send the outcome information to us for the quantitative analysis. This tweak will enable us to carry out our impact evaluation analysis without needing to make any changes to existing site policies and processes. This is just one example. All in all, it has been a huge learning curve for our team to get the grips with this complexity and work out how to respond where we might find that data is not consistent and contains gaps.
Thank you so much, Ines. That's really useful to hear. And I think it's really interesting to reflect on the ways of working in partnerships with the sites to make sure that this evaluation is something that does work for them. It's also really useful, I think, that we're able to share the benefits and practicalities and considerations that come from using administrative data sets to measure outcomes, because as you say, they can be quite complex. Now, I know it's too early to be in a position to share any findings from this work. However, could you just let us know what we can look forward to learning about in the upcoming annual report?
Of course. So in the upcoming annual report, we will be sharing the progress from obtaining consent from beneficiaries across all ABS sites, and more importantly, how this is going to shape the final decisions about the quantitative analysis approaches.
That's great. Thank you so much, Ines. And we'll look forward to having you back on the podcast later on. Now we're going to hear from Natasha Phillips, who's leading on our work on understanding ABS implementation and how and why services can affect outcomes for children and also systems change in the early years sector. Natasha, can you give us a summary of what this part of the evaluation involves?
First of all, thank you, Mary, for having me. Our team are trying to understand what's working well and what's more difficult across the 5 different ABS partnerships. So in order to do this, we've been speaking to people involved in delivering ABS from across the 5 ABS areas. This work has been a continuation of our evaluation work in 2022 and has involved hearing views and experiences from a range of different people. This has included people who are very involved at a senior level overseeing ABS work to those who are working on one specific service in one area. We've spoken to practitioners such as speech and language therapists and midwives, managers of ABS services, those working in parental engagement roles, professionals with strategic roles, and those sitting on ABS partnership boards.
These are such important perspectives to include as part of the mosaic of evidence that we're working to build through this national evaluation. Do you have any reflections on challenges that have happened and how you've been working towards overcoming them?
So one of the main challenges that comes to mind when we're thinking about this aspect of the evaluation is bringing the different views and perspectives together from each of the 5 ABS areas. As you can imagine, each of these 5 partnership areas has different set of services, ways of working, structures of governance, and priorities. This is combined with considerable differences in the demographics of the people who live there and the strengths and challenges within each place. As we're speaking to a vast array of different people, we chose to focus our conversations with people on the specific projects or services they're involved in. Speaking about ABS as a whole could be difficult and end up with respondents giving very broad and general statements. So instead, we've explored people's own experience of ABS and gained an understanding of what ABS looks like in practice for them. This helps respondents speak from a place of knowledge and expertise and has provided us with nuance and detail. However, this means we end up with very rich, detailed data about a lot of different services in different places. Our aim is to bring these different views and perspectives from each of the areas together to help us generate insights at a national level. This is something that's been both a key challenge and an opportunity for the national evaluation.
Thanks, Natasha. And I know I've really been seeing that come through in your work and as the findings emerge through the reports that we've been producing. Can you talk us through some of the strategies and ways that you've worked through these challenges or tensions and have made the most of the opportunities that this rich data set presents?
So this is something we've kept in mind throughout the evaluation, for example, when designing research tools, speaking to respondents, and analysing the data. One method we've found has been to think about the points of connection between the different partnership areas. In particular, we've done this through focusing on the 4 main outcome areas for ABS: diet and nutrition, communication and language, social and emotional development, and systems change. This has helped us understand common successes and challenges across similar services. One example that comes to mind is around diet and nutrition services. So ABS respondents from several different partnerships have described diet and nutrition services as working to deliver a pathway of support and training for parents or carers as their child gets older. So from infant feeding to introducing solids, all the way to provision of healthy foods. Another way we can use this wealth of experience and knowledge is to focus on the way that people are working and how the ABS is helping them to work in new and better ways. For example, respondents from across partnerships and services talked about how involving parents and carers has been key and consistent part of ABS in a way that is different to other services and governance structures that they've experienced. Finally, as we have 4 years to do this work, we also have the benefit of time on our side. This allows us to speak to different people involved and build a better picture of what's going on, both across the 5 ABS areas and the 4 outcome areas. As we go through the evaluation, at each stage, we're not only thinking about who we've spoken to, but considering whose voices and experience are missing and try to fill in those gaps. Obviously, we can't speak to every person involved in ABS, but now we're in year 3 of the fieldwork, we are starting to feel like we're getting a good spread and breadth of experience. This helps us better understand the links and similarities, as well as differences across the ABS areas where points of commonality have been attributed to ABS.
That's great. Thank you so much, Natasha, for sharing those reflections. And just before we move on to our next speaker, is there anything that you can share in terms of learning and what we have to look forward to in the upcoming annual report?
So findings from interviews have highlighted a number of common themes across child-level outcomes, and those include a focus on early intervention and prevention to reduce the need to correct issues later. Improving parental knowledge is another key element of service delivery, with services providing parents with strategies and resources to promote healthy choices at home. Successes included effectively working with partners to coordinate care and make sure families were receiving the right support at the right time. And as with previous waves of data collection, the impact of the cost of living crisis and staffing issues within services continued to be a challenge.
Thank you so much, Natasha, and we'll look forward to having you back later this afternoon for the group discussion.
Thank you for having me.
Professor Janet Boddy is now with us, and she co-leads, along with Professor Jill Hampton-Thompson, the part of the evaluation that explores families' experiences and journeys through ABS. Janet, please could you give us a flavour of the work your team has been doing to learn about these families' experiences?
Yeah, I'm really happy to do that. Thanks, Mary. So we're interested in trying to understand, as you said, families' journeys over time with A Better Start. So how A Better Start fits into family lives over time and the difference that it makes to them. And to understand that, we're doing long-term interviews with 25 families across the 5 ABS areas who have very carefully selected to include a variety of experience, family structures, and so on. And we're visiting each family once a year, and then we do a catch-up telephone interview with the primary caregiver halfway through the year. And I think it's really interesting work. It allows us to capture the way that families' lives change over time, and also the way the nature of their involvement with ABS changes in response to that, and then to see the difference that can make for them.
Great, thanks, Janet. Yes, on a project like ABS that's so large scale and taking place over such a long period of time, I'm really happy that we have this element of the evaluation that allows us to keep in touch and build relationships with families over that period and understand the difference that the program makes. How have you found things? How are they going? And kind of within this, have you experienced any challenges with the work?
Well, I think it's a really interesting question, because that strategy, working with a small number of families in such depth, it could be challenging because it depends on those families staying involved with the research over time. And I mean, we have a strategy for dealing with that, which would be to invite new families to join the study if families chose not to continue or weren't able to continue. But actually, and we're just about to start our 4th interviews with families. I think the first one's actually happening this afternoon. And I'm really pleased to say we've had excellent engagement from families. So we've visited them twice. We're just starting the next round of catch-up interviews. And we're actually in touch with all of them, with all 25 families still. So that's a year and a half into the work with them. We had one family who didn't take part in the second interview, but they did take part in the third interview. A different family didn't take part in the third interview, but they're still in touch, and we're expecting to speak to them this time around. And that's, I think it's normal in long-term studies like this that people might move in and out, but we're really delighted that we've had such a great response from the families who take part.
Yeah, it's really great that so many, I mean, all of them have maintained engagement at this level. And thinking about the approach that you and your team take to this area of the evaluation, is there anything that you think that you've done that you feel has contributed to that level of engagement and retention over time?
Yeah, I think there is. I think it's down to our approach, which is a very respectful approach and a very flexible approach that fits around families' preferences and what's convenient for them, and a very strong emphasis on ethical practice in our work with families. So we've been very lucky that we've been advised by the parents panel for the evaluation. And we've been guided by their advice. We've also put a lot of practical effort into building trust, building respectful relationships, and making sure that taking part is interesting and even can be enjoyable for families. So we're not just adding stress to family lives that we know are always busy and often challenging. And we put a lot of emphasis on child-friendly methods to help with that. So the visits to the family involve anyone in the home who wants to take part, and we make maps and bring pens and stickers and so on. My colleague Ali Lacey, who's conducting the interviews, I think she's known by one family as the sticker lady. So that gives you a sense of the kind of relationship that we try and maintain with the families. And I guess the other thing relating to that is that we're very clear for ourselves and with the people who take part that the success of our work depends on their help and their generosity in sharing their experiences. So we give people thank you gift vouchers, which is a marker of appreciation for their time. We also send thank you cards after each interview, and we do, to follow on from the annual evaluation report, we do an annual newsletter which is translated into community languages. And we also send birthday cards to children, which is just a way of letting families know that we keep them in mind in between the visits, which we very much do. And I guess the other thing that I might add to that is that thinking about the families who've dropped out and come back in is about just being kind of patient and respectful and sensitive, which is part of recognizing that, you know, this research is top priority for us, but it might not be the top priority in their lives. I mean, far from it, depending what else is going on. So, for example, the family who didn't take part in the second interview were going through a really difficult period at that point. And we know about that because the mother came back into the study and then was able to talk about that in her third interview. And things are still tough for her, but she's now at a point where she's able to talk about what's been happening. And really importantly for the evaluation, to talk about how A Better Start provision has supported her during that really difficult period. And if we didn't have those kinds of relationships with the families in the study, that's information that we would never get access to. That's information we wouldn't be able to learn from. So the relationships really matter for the data quality and for the understanding in the evaluation as well.
Thanks so much for sharing those reflections, Janet. And as you say, it is really the relationships that are at the heart of making this work for both the evaluation and for the families taking part. And I wonder if listeners can also think about their own research and evaluation practice and whether this resonates, or there's opportunities to try out new things in their own work with people. And I'm wondering if there's any learning that stands out that you'd like to share with the listeners and what we have to look forward to in our upcoming annual report.
Yeah, I think, we're really excited about the learning that's coming out of the interviews with families. And I think one of the things that's been really striking for us, which is quite, I think, distinctive to that kind of place-based approach that A Better Start has, and that emphasis on partnership with parents as well, actually, is what we're referring to as kind of tapestries of care within local communities. So that's a mixture of formal and informal networks. So professional support through ABS, through other professional agencies or specialist referrals and so on, but also friendships and community connections much more informally. And the way in which those, I'm waving my arms around, the way in which those knit together and can support families through some very challenging times in their lives, which is one of the other things that we're hearing about as we've been doing these next stages of work.
Thank you so much, Janet, and we'll look forward to speaking with you more later on in the podcast.
Yeah, thank you.
And finally, we have Beth Young with us, who leads on the economic evaluation to understand the contribution made by ABS to reducing costs to the public purse relating to primary school-aged children. Beth, can you tell us a bit about what you've been working on over the past year?
Thanks, Mary. The work that Innes described earlier about using existing data from NHS England and DFE focuses on a range of outcome measures relating to pregnancy and early childhood. These are referred to within the ABS programme as the Common Outcome Framework measures, and they include things like perinatal maternal mental health for mothers or low birth weight in relation to the child. But the work in this area is about estimating how a change in those maternal or early years outcome measures is likely to impact public sector cost savings during the child's primary school years. So we have to make that causal link between early intervention in pregnancy or the early years and the use of public services by the child from the age of 5 to 11. The approach that we're using is called cost consequence analysis, or CCA. It's a form of value for money evaluation that assesses a wide range of costs and consequences of a programme or intervention, aiming to cover a broad range of costs and consequences, some of which can be quantified and monetised, and some of which will be qualitative in description. Our process includes identifying causal connections, or what we're calling a causal chain, between the ABS Common Outcome Framework measures and outcomes for primary school-aged children, and the associated costs to the public sector relating to those outcomes during the child's primary school years. Where possible, those costs are then summed up to estimate overall costs avoided due to the achievement of each outcome, which can also be broken down into certain cost categories, such as education, health, and social care.
Thanks, Beth. That's so interesting, and it's such a nuanced way to approach the economic evaluation of ABS. And again, I just want to remind listeners to look at the National Evaluation Protocol, which is available to download from our website. And you can find more information there about the detail of the methods that we're talking about today, and also the Common Outcomes Framework that Beth is referring to. Can you give us any examples of a causal chain and talk through any challenges that you've been grappling with along the way?
Sure. So if we take the first common outcome measure, which is perinatal maternal mental health, there's existing research evidence that shows a link between perinatal maternal mental health and risk of preterm birth, emotional or conduct issues in the child. These issues can lead to additional intervention from social services, healthcare professionals, and the education sector during the child's primary school years, which obviously then comes at a cost to the public sector. However, early childhood development outcomes are often interlinked, and they can influence the same or similar downstream outcomes during this child's primary school years. So obviously that's one of the reasons why ABS is focusing on the three core domains of communication and language, social and emotional development, and diet and nutrition. But in terms of the work that we're doing, what that means is there's a danger of double counting, because there may be some overlap between the causal chains and outcomes, which could lead to double counting of the costs avoided, and mean that we end up overestimating the costs avoided by the ABS programme as a whole.
Interesting. And what would that double counting look like in practice?
Okay, so for example, sticking with perinatal maternal mental health, which is the common outcome framework, outcome number 1. That can impact the child's experience of abuse or neglect. Common outcome framework measure number 22 is child abuse and neglect, children aged 0 to 4, children in need due to abuse or neglect. And that in turn can impact A&E attendance or emergency hospital admission due to unintentional or deliberate injuries of the child. And that's common outcome framework measure number 25. And therefore, obviously, A&E or hospital attendance would impact healthcare costs. So that's an example where the causal chain, there's a lot of overlap within that causal chain, and we may be picking up the same cost avoided twice.
It's such a complex picture to be working with. I can really see where this challenge would arise. What steps have you been taking to work with this and reduce the risk of double counting in the evaluation?
Well, we're currently working with the academics at the University of Sussex to help us identify those potential overlaps in the causal chain and agree suitable approaches to reducing the risk of double counting. In some cases, this might be to only count one chain. For example, using the earlier example, we'll focus on the strongest links or evidence within that pathway. The alternative is to try and identify part of subsequent causal chains that exist independently of the first. So, for example, the proportion of the impact of children in need on outcomes associated with abuse and neglect that's independent of perinatal maternal mental health.
That's great. Thanks so much, Beth. Now, before we move on, can you share anything in the way of what you've been learning over the past year and what we can look forward to in the upcoming annual report?
Yes, absolutely. I think probably for us, the biggest learning has been just the difference in approach at a partnership level in terms of what they're focusing their ABS spend on in response to local needs. And that has been a big learning for us and probably is much more diverse than we were expecting, probably coming into the evaluation. So that for us has probably been the most interesting finding. In terms of new and what to expect in the annual report, this year we've been able to incorporate some analysis of the beneficiary data, which has been compiled and collated by the fund. So that has been a really interesting nuance to our analysis to date, just allowing us to see that bigger picture of number of beneficiaries reached.
Oh, fantastic. It's great.
Lovely. Thanks very much, Mary.
I mentioned at the start of this podcast that the 4 parts of the evaluation are working together to develop a mosaic of evidence that will enable us to understand the impact of ABS and the contribution that it's made on outcomes for family, young children, and systems change. And as we've heard throughout the discussions today, the different parts of the evaluation are all at different phases, and we're all together now to take a moment to discuss how these different parts are working together.
Exactly, Mary. I mean, I mentioned earlier about the links between Innes's quantitative analysis and our work on the costs and consequences. But it's important to also acknowledge the inputs from Natasha's work with the practitioners and Janet's work with families in helping to actually select those quantitative outcomes in the first place. Because that's how we did it, right from the beginning. We built on what we had learned through other aspects of the evaluation to select those quantitative measures that the national evaluation was going to focus on going forwards.
Yes, definitely. And something I think is important to reflect on is that in a programme as large scale and complex as ABS, the breadth and depth of our research with practitioners and stakeholders is allowing us to see patterns in the factors that lead to outcomes. We're also able to distinguish between ways of working which are specific to one outcome area versus those that are evident across the different outcomes. We link the evidence about what ABS practitioners and stakeholders tell us with emerging findings from other objectives. And it's been really interesting to hear and find out more about those connections.
Yeah, I think we really see that in terms of the work that we're doing with families and the links with that and the research that Natasha's leading with ABS practitioners and stakeholders. So one example would be that the kind of understandings of local contexts and local provision that come out of the work that Natasha leads, they're really key to understanding families' accounts of their experiences with ABS within a place-based approach. And I guess the other side of that is that what we're learning from families and their perspectives and experiences, that's also really important in understanding what professionals talk about in their interviews.
Definitely, yes. It's been really helpful to hear about families' perspectives and how that kind of informs our own research. So even though it's not possible to speak with everyone involved in ABS, I think being able to see these different connections increases our confidence in our own findings and provides us with some opportunities to dig a bit deeper or focus on particular aspects that are coming up in following rounds of data collection. And with several waves of fieldwork, we do have time on our side as well. So our depth of understanding continues to grow throughout the evaluation.
Yeah, I think, again, that's really important with families as well, working with them over time. It helps us to understand, I was talking about this a bit earlier, how their journeys with A Better Start intersect with other changes in family lives over time. Families are dynamic, and that's both in terms of understanding how ABS provision can respond or adapt to external changes in family lives, but also in terms of how ABS can shape family practices and routines and shape change in family lives. And in that sense, I think our work with families, I would say this, wouldn't I? Our work with families is really important and really powerful in explanatory terms within that overall mosaic of evidence that you're talking about, Mary, because it helps us to think through the meanings of evidence from other parts of the evaluation.
Absolutely, Janet. And I can think of an example from a recent discussion whereby your team has uncovered very clear examples which show how APS provision can help with early identification of children with a special educational need or disability, and help with corresponding access to specialist assessment and intervention. And the first annual report includes an example of just that in relation to language and communication. And that can be recognised as a positive impact of ABS. The child's needs being recognised and appropriate services are being accessed. But in terms of our work and what we're doing, that kind of insight is really relevant to the cost consequence analysis, because in the short term, the family are using more services and more costly specialist services as well than they would be using if their child's needs were not identified and not met. So that's not a cost reduced or avoided in that sense, although we can anticipate that sort of timely and early intervention and appropriate support will be protective for that child and that family and should contribute to cost avoidance in years to come.
Yeah, I think that's really true. And I guess what I would add is that the accounts that we're getting from parents and carers in particular, and that qualitative evidence also shows what you might term ethical benefits, which are really important to document, but perhaps harder to quantify economically or statistically, and so might otherwise be in danger of being missed. And that's part of where the mosaic of evidence comes in again, isn't it? So what value do we attach to the fact that a child who needed help is being helped? Or if I think of other examples in our interviews, that a parent who was struggling previously is happier, is less isolated, is more confident as a consequence of her involvement with that network of services, that network of supportive relationships that she accesses through A Better Start.
The weight that each of these parts of the evaluation brings to the whole is so apparent in conversations like these. It really shows the value of leaning into and working with the challenges and complexity of ABS so that we can continue to work towards that really rich understanding of the programme's contribution to families with young children and systems change. Anas, I'm looking ahead now and thinking about the quantitative analysis that you'll be starting later this year on outcomes. How do you think that those findings will be folded into the mosaic of evidence?
Yes, Mary, we will be using several statistical approaches for the quantitative outcome analysis because of the variety existing between the data sources that we are drawing on. Having different statistical methods will bring benefit of allowing us to link the findings within this work stream and with others like Janet's work, Pat's and Natasha's work. For example, it is going to help us see whether we find the same pattern of results emerging consistently, or if the evidence is more mixed from different approaches we are using. But a challenge that we will need to face as the evaluation reaches its conclusion is going to be working out how to effectively communicate findings that come from different statistical methods and other works. Some of our approaches are quite technical, so we will be working with the evaluation team, including parent and practitioner panels, to ensure our results tell a clear story and are well integrated into the mosaic of evidence.
Thank you again for joining us today for this discussion. I really hope that you found it interesting. In addition to getting more of an insight into the mechanics of this complex national evaluation, I hope that it's given you some food for thought about your own research and evaluation practice. We published our first annual report of the national evaluation in May 2023, and we'll be sharing more emerging findings in another annual report coming this spring.